Good afternoon again. I'm Dr. Janet Ogunkoya. Welcome to our webinar session. I work with Avon Healthcare Limited, and today we'll be talking about more than just chest pain, recognizing heart illnesses, signs on time. There is a myth around heart conditions only being associated to chest pain. Today we'll be breaking that myth because we have a consultant cardiologist with us who will be shedding more light on cardiac illness, heart conditions, what we need to know about, what we need to know about heart condition. Is it only chest pain you need to feel before you know you have a cardiac condition or a heart disease? Do you even have it or not? We are going to really break it down. So with me here today, we have Dr. Akingunmi Michael. He's going to be, like I explained earlier, he will be taking us on this topic. I'll be asking him some frequently asked questions. And by the time we are done, we will take questions from the audience. So if you have any question in mind, even if it's not, if we don't get to mention it, you can ask by the end of when we are done taking the frequently asked questions. We are going to open up the Q&A section where you can type in your questions, and Dr. Akingunmi is going to explain everything and give answers to all our questions. And if you don't want to post with your name, I think there is a way to post anonymously, so you can do that also, so that you can make to make you comfortable asking your question. So before we start, I'm going to briefly read out Dr. Akingunmi's bio, and we go ahead with what we have today. Dr. Michael Akingunmi obtained a Bachelor of Medicine, Bachelor of Surgery at the Premier University of Ibadan in 2009. He did his 1-year mandatory housemanship training at FMC Abeokuta. He proceeded for his compulsory youth service at Primary Health Center, Dadu, in rural Kaduna. He commenced his residency training in cardiology at the Lagos University Teaching Hospital, LUTH, Idiaraba, in January 2012, and completed his training in November 2018. He was appointed a consultant cardiologist at Avon Medical Practice in April 2021 till date. He is a member of Nigeria Medical Association, Nigerian Cardiac Society, and European Cardiac Society. So welcome, Dr. Akingunmi, to this session. We are so happy to have you here with us. Good afternoon, sir. How are you doing, sir?
Yeah, good afternoon, Dr. Janet. Thank you for having me. Thank you so much.
All right, thank you, sir. So we'll just go right ahead because we've really delayed a lot of our attendees. And again, once again, sincere apologies for the delay. We had reasons beyond our control, and we are glad we've started. All right, Dr. Akingunmi. So can you just give us a general overview on heart illnesses, the basic things we need to know before we move on?
Yeah, okay, thank you, Dr. Janet. As we know, the heart is one of the organs in the body, perhaps one of the most important. It's the only organ in the body that it's dynamic. It continues to move right from birth until the end of life. And so once the heart stops beating, that signals the end of life. Incidentally, also, the symbol of the heart is the symbol of love. And of course, we also always preach love goes around to go around the world. So the heart is a very special organ in the body. Heart illnesses, so there are different conditions that can affect the heart. The most common being blood pressure, high blood pressure can affect the heart, leading to serious heart conditions. You could have chest pain, angina. The heart, if it fails, it can lead to what we call heart failure. We need to be conscious of a lot of all these conditions because they are getting increasingly common in our environment. Dr. Janet, I would just like to stop here.
All right. Thank you so much, Dr. Akingunmi, on that. Yes, we have a lot of heart conditions, and they are getting really common, especially for our race and in this part of the world. We'll talk about the risk factors for heart conditions later. But in the meantime, can we talk about the main problems of heart diseases? What really causes heart disease, the main problem behind heart diseases?
Sorry, you said what? Can I get that again?
The main problem of heart diseases, the causes of heart diseases.
Okay, so causes of heart diseases. One, the most environment is high blood pressure, hypertension. So that's it's in Lagos, the last prevalence studies is almost 60%, which means that 6 out of 10 Lagosians above the age of 18 has high blood pressure. That's significant, and that's quite huge, and that's quite much. Other heart conditions include valvular heart disease. There are 4 valves in the heart. One is the mitral valve, 2, the tricuspid valve, 3, the aortic valve, 4, the pulmonary valve. Commonly, the mitral and aortic valve are always having issues, and whenever they have that, that can also lead to heart conditions. Also, people can also have inherited cardiomyopathies in which the heart is enlarged, bigger than normal, and that can also give rise to issues too. These are one of the these are few conditions of the heart that are quite common in our environment.
Thank you so much, Dr. Akingunmi. You said something very major. 6 out of 10 Lagosians above 18 years have high blood pressure. Wow. That's a wow moment, something to really ponder about. Lagos is, I'm sure, the busiest state in Nigeria and very, very stressful. And you'll be surprised that some people enjoy the hustle and bustle of Lagos. They think it's nicer, or other states are too calm, I cannot function well. Whereas the stress is even killing us. Wow, 6 out of 10 Lagosians above 18 years, not even 40. Because before we used to think the older you get, the more predisposed you are to these things. Now it's 18 years. Wow. That's amazing. Thank you so much for that. So now this takes me to, if high BP and heart conditions are very predominant, they are very common, what are the risk factors? Because we hear people say, oh, you say drinking and smoking or this causes this. Whereas I know somebody who has been smoking all their lives, who has been drinking all their lives, they don't have any condition, they are kampe, then they kampe, they are fine. Whereas somebody who is living their life very right, they've not even taken a sip of alcohol, before all of a sudden you find out they have a very, very bad health ailment or heart condition and things like that. Or you hear things like, my parents didn't have it, so I don't think I will have it, or it doesn't run in my family. Can you please shed more light on the risk factors and the things that predispose people to having heart illnesses?
Okay, yeah, so thank you, Dr. Janet. Top on the list for heart conditions, it's genetic. And by genetic, so I mean family history. So the way people inherit skin color, the way we inherit the color of our eyes, the way we inherit the height, the same way people also inherit heart conditions too, especially blood pressure. So the singular most important risk factor is family history. So if either of the parents have had blood pressure in the past, there's a very strong predisposition that the child can also have blood pressure. Also, aside that, so other risk factors include stress. Stress is not just only physical stress. And we quite know that that's quite much in Lagos with traffic, with a lot of hustling and bustling everywhere. Physical stress is almost at its peak in Lagos there. Also, emotional stress, mental stress These are risk factors. Also, thirdly, use of stimulants. By stimulants, I mean use of coffee, either the caffeinated or the decaffeinated coffee, use of cola nuts. Some people enjoy cola nut to stay up late at night to study. Also, alcohol, all forms of alcohol, including beer, whiskey, wines, all forms of alcohol, are also risk factors for heart conditions. Also, we also know that obesity is also a risk factor. So, anybody with body mass index more than 25, that's also a risk factor for heart conditions. And lastly, in dietary discretion, so use of excessive salt in food can also predispose to heart conditions too.
Wow, thank you so much, Dr. Akingunmi, for that. I've just been taking notes and taking notes. My page is full. So you spoke on genetics. I love the way you put it. You said the way we inherit our skin color, our
Exactly.
eye color,
Exactly.
our face. Some people look at and say, "Oh, you look so much like your dad," or "You look so much like your mom." So also these
Exactly.
things, these heart conditions are inherited. So it's very good
Exactly.
to know our family history. Ask
Exactly.
questions if you need to. Ask this person who passed on, or this person who this uncle or aunt, or your family members, your close relatives, if they have any condition that they are managing. So it's very good to be well informed about your family lineage. And you said stress. Stress
Exactly.
cannot be overemphasized. Both physical, mental. There's stress everywhere. There's stress in Nigeria. There's stress all over the world. Just looking at the news alone can make you stressed. So these
Exactly.
are serious risk factors. Then stimulants. I love how you started with coffee. That's a whole story for another day, because we can go into that for hours and not stop, because coffee can actually precipitate a lot of things in the human body. But what I would like you to shed more light on is smoking and drinking. How does it affect the heart? Because people when you are not well informed, you assume a lot of things. And because one has been smoking for a decade or 2 decades or 3 decades and they're fine, they feel nothing can happen to them. So how does smoking and drinking, how does it directly or indirectly affect the heart?
Okay, fine. So, thank you, Dr. Janet. I'll start with smoking. So smoking is it's a no-no. It's one of the very strongest factors for heart conditions. Why? Because smoking actually destroys the vessels. Smoking on its also, apart from destroying the vessels, also destroys the heart. And so we try to encourage people not to smoke not to smoke at all. So I think there are two categories of people. Either you're a non-smoker or you're a smoker. So for non-smokers, we are advised not to even start smoking at all, because smoking is going to can destroy the vessels. And so for people who are smoking, we advise for them to stop. So if you have smoked before in the past, you should know that continuing to smoke is going to continue to damage the heart. So it's still advisable that you stop so that you don't further damage the heart the more. And it includes all forms of cigarettes, even electronic cigarettes. So some people say, I don't do the conventional cigarettes, I do the e-cigarettes. The e-cigarette also has been associated with significant risk for blood pressure, and also significant damage to the heart too, including tobacco, all forms of tobacco, including not even only cigarettes, so recreational drugs, weed, or all manner of names they are being called. All of them actually destroy the heart. As regards alcohol also like I mentioned earlier, is also a stimulant, and all stimulants are risk factors for heart conditions. And so for alcohol, we tell people to reduce to barest minimum. For some people, if you can stop, we advise that you should stop. But if you cannot stop, we advise it should be reduced to the barest minimum.
Wow, thank you so much for that. So you said your best advice to give somebody who hasn't started smoking or drinking is do not start. And if you've
Exactly.
started, to stop, to quit.
Exactly.
Thank you so much.
Exactly.
You mentioned especially those who this electronic cigarettes and stuff. You know, they say, oh, it doesn't have the smoke, it doesn't have this, it has been filtered.
Exactly.
They're all
Exactly.
the same thing.
All
They
of them.
all they all have the same harmful effects. Thanks so
Exactly.
much for that, Dr. Akinkunmi. So my next question is, from these risk factors you highlighted, the dietary part, the obesity, alcohol, stimulants, stress, genetics. Um, as you've mentioned it, some people can tick these things from their table. They will tick these things and say, okay, I have this, I have 2 out of 5, I have 3 out of 5. Or someone will say, I don't at all, but I still have occasional elevated blood pressure, or I have some form of heart illness or the other. What will you advise? How will you advise these people, those that have some of these risk factors, and the people that don't even have anything at all? How will you advise them?
Okay, so thank you, Dr. Janet. Okay, so I'll speak to the people that have the risk factors. So one, if you smoke, there are a lot of support groups around that can help you. So we must learn the habit of asking for help. It might be difficult for you to stop on your own. Just speak to anybody in the health sector or anybody in an hospital to direct you. There are several NGOs who have invested into this for you to get support. So ask for help if you smoke so that you can quit smoking. It's challenging. And so that's one. Two, for people who takes a lot of alcohol, we advise that you reduce alcohol to the barest minimum or you stop completely. So perhaps so that's what I'm going to say as regards that. For dietary indiscretion, we advise for you to reduce salt in food, and not just only salt. To reduce Maggi, curry time should be reduced. Just personally, I advise people to reduce by half. So whatever quantity of salt, Maggi, curry or time you use to cook presently, you just cut by half, by 50%. So if you use 4 cubes of Maggi, you reduce to 2. So that's what I advise. For people who are obese, they should seek help to actually reduce their weight. So we encourage people to exercise. So you can, of course, exercise and diet are one of the two surest ways to actually lose weight. So we advise you to walk or register in a gym and get an instructor who is going to put you through a weight loss regimen. For stress, people must adopt stress reduction techniques. Several places of work now have policies on reducing stress because of the negative impact it has on the health of workers. So if you work in any company or you work in any organization who has such, we advise that you tap into them. As part of efforts and reducing stress, we advise people to sleep well. So adults should get adequate sleep, 6 to 8 hours in a day. Poor sleep is going to increase your stress level, stress hormones, and that could also has negative impact on the heart. So people should learn to sleep well. People should also learn to also go to spas to get massage. These are part of stress reduction techniques people can do during weekends for themselves. Also, part of stress reduction techniques is also some forms of exercise. So light walks in the evening, 15, 20 minutes in the evening can also help to reduce stress. Also, people can also adopt hobbies and sports. You can adopt the sports. These are also part of stress reduction techniques. Table tennis, lawn tennis, any of the sports can be adopted, will be fine. 20, 30 minutes alternate days in a week will be fine. It's also part of stress reduction techniques people can tap into.
Okay, thank you so much, sir, for that. What I gathered so many things. Know your numbers and keep them within the normal limits. And the part where a lot of people won't really like is cut it by half. Well, the cardiologist has spoken. So some of us that like spicy food, some people like their food tasting top notch. Even wives like cooking very good food for their husbands. And now the cardiologist is saying if you use 4 Maggi, cut it down to 2. So you need to sit down with daddy and say, the cardiologist has spoken. For us to take care of your heart, we need to reduce the sodium and all these things in the food. And stress reduction techniques like exercises here and there, massage and all that. But let's move into exercise. There is this myth, or there's this saying that those that have heart conditions, they cannot work out. Is it advisable to work out if you have a heart condition, or there are certain heart illnesses that you cannot work out? So can you please shed more light on that? Can I work out if I have a heart condition or not?
Okay, so thank you, Dr. Janet. I will speak to blood pressure first. So the commonest heart condition environment, high blood pressure. So if you have high blood pressure, you can actually exercise. We advocate you to walk 30 to 40 minutes 3 to 4 times in a week, and that's like alternate days for you to walk. So that's for blood pressure. But yeah, so some heart conditions might not allow you to exercise. That's true. So I would advise that you speak with your cardiologist. So your cardiologist will be able to, so we call them graded exercise regimen. So your cardiologist will be able to speak to you as regards the exercise, how much exercise you can do. Because exercise can actually worsen some heart conditions. So for some of heart conditions, we advise that you just rest. So speaking to your cardiologist, he or she will be able to advise you on the kind of exercise that you can tolerate. But generally speaking, the commonest one is blood pressure, and for blood pressure, 30 to 40 minutes alternate days a week, alternate days in a week, walk will be fine.
Thank you very much, Dr. Akingunmi. So we'll be taking our last question, and I want to tell everyone, after our cardiologist answered the last question, we are going to open the Q&A box. So if you have questions, please drop your questions. He's going to answer all our questions. And if you don't want to post your name, you can post your questions anonymously. So that's fine also. So after we take the last question, we're going to start taking questions from our audience. All right, so the last question is, what treatment options are there for me? What are the treatment options available for people who have heart conditions, aside obviously going to see their cardiologist? So what are the treatment options available for heart conditions?
Okay, so Dr. Janet, there are medical and surgical options. Of course, medical options includes medications. So on medications, I'm still going to go back. We speak to blood pressure. So for hypertension, once your doctor assesses you, cardiologist, and confirms that you have high blood pressure, you'll be started on medications. Now, these medications you're expected to take every day. Yeah, so it might be cumbersome, but even when the blood pressure becomes normal, you are still expected to take the drugs every day, because if you don't do that, the numbers are going to go up again. So it's important that we note this part, that blood pressure medications are to be taken every day. Sometimes we get the question, what time of the day should I take medications? Well, generally speaking, the best time to take the medications is in the morning. Personally, I advocate that people take medications before they leave the house in the morning, because when you take the medication before leaving the house, you are not likely to forget to take the medications. Also, apart from high blood pressure, other heart conditions also, there are medications for them in which you need to take. You need to take them every day, or as prescribed by your cardiologist. Also, I mentioned earlier that some people have valvular conditions in which they have issues with their valves. When it gets serious, we might advocate that people go to do surgery, and that surgery is basically going to replace the defective valves in the heart. Like I said earlier, the commonly affected valves are the mitral valve and the aortic valve. So people can be advised to undergo replacement of the mitral valve, replacement of their aortic valves. Also, sometimes the vessels in the heart can be blocked, in which people can have coronary artery disease, in which they present with chest pain. If that is the case, people might be required to go through procedures to revascularize the vessels in the heart. By that, I mean that to clear the blockage in the heart. So basically, I've talked about use of medications as a treatment option. I've also discussed the use of surgery, replacement of valves in the heart as a treatment option for heart diseases. And also, I've also discussed the use of procedures as regards people with coronary artery disease, blockage of the heart, as also a treatment option for chest pain from such conditions.
Thank you so much, Dr. Akingunmi. One major thing you said is the best time to take your drugs is in the morning, so that you won't forget to take your drugs during the day. And one other thing you also said about exercise is if you have a heart condition, consult your doctor, consult your cardiologist before you start running on the treadmill. And aside that, the best way to exercise if you have a heart condition is walking, at least, so that you don't exert yourself too much. Thank you so much, Dr. Akingunmi. It's been really educative. And now we are going to go into the questions and answer the question and answer session. And the first question is, hi, Doc. I am 30 and I've been taking high BP meds since last year. I think this person is still typing. Okay, let me see if there is a continuation. Okay, hi, Doc. I'm 30 and I've been taking BP meds since last year. I observed that when I play football, I get difficulty in breathing and chest pain. I can't even last 10 minutes on the pitch again. My numbers have been okay since I started taking the drugs. What does this mean?
Okay, so Dr. Janet, can I answer the question? Okay, so what you have basically described is what we regard as poor exercise tolerance. So you can't tolerate the level of exertion which you used to tolerate in the past. So in the past, you play football, you are fine for minutes, hours, and now before you play just 10, 15 minutes, you get tired easily. I'm happy you said you check your numbers and your numbers are fine as regards blood pressure. So you might need to see your cardiologist to do further evaluation of the heart. So you might need to do investigations to find out if there's any relationship between your heart and the complaints of the poor exercise tolerance which you have. So my advice to you is for you to book an appointment with your cardiologist and explain, and further tests and evaluation will be done to try to unravel the cause of the poor exercise tolerance which you presently experience.
Okay, thank you very much, sir. The next question, you mentioned stress reduction techniques. You mentioned massage, you mentioned exercises, playing tennis, and the likes. Someone is asking, how do we reconcile sex and stress relief? Is stress relief? That's difficult. Is sex is stress relief? How do we reconcile both? We are talking about massage, working out, and all, and our beautiful audience here is talking about sex and stress relief. So, sir, please shed more light on this.
Okay, well, so yeah, thank you, Dr. Janet. Sex is actually a lot of exertion. You need to be physically fit to actually complete a good round of sex. So But we will not regard sex as exercise. Well, so if you want to exercise, either you walk or you register in a gym, and get an instructor, that instructor to actually supervise your exercise for you. What I can say that sometimes when people come down with some health condition, we will advise them to avoid sex, because they can't even withstand the stress of undergoing sex. So that's what I would say. And also that people need to know that some medications for the heart also interact with some sexual enhancement products and medications. So when you are with your cardiologist and is prescribing, you might want to ask, you might want to tell your cardiologist, I also take one or two sexual enhancement medications. Is it going to interact with these medications? And let the doctor advise you if it will interact, if it doesn't interact, because sometimes that could also have some grievous consequences. Some people want to hide the fact that they take some of these medications, and eventually it might end up in fatal consequences for them.
Wow. Wow. Quite educative. Thank you so much, sir, for that. So the next question is, for people who are genetically predisposed and on BP 130/90, what are the organ damage risks where doctors have not prescribed medications? My doctor says I should exercise for now. So this person is genetically predisposed. BP is still is 130/90. The person is concerned about organ damage, and the doctor told him or her to exercise for now. So what can he or she do?
Okay, well, for people with blood pressure, sometimes the cardiologists have the discretion to give 3 to 6 months of lifestyle modification before commencing medications. For some people who are very faithful with the lifestyle modifications, cutting down on salt, reducing stress, sleeping well, avoiding stimulants, a lot of them actually, few people can actually do well on that, and the numbers actually come back with that. But generally speaking, we all know that some of these lifestyle applications are challenging. They are not easy. Some people find it difficult to cope up with them. They struggle with them. And with such people, after the 3 to 6 months of that grace, they start the medication. So I want to assume that perhaps this person is still within 3 to 6 months, and so the doctor wants to see if those lifestyle modification will help the numbers within 6 months. But of course, if after 6 months the blood pressure is still this, I know perhaps he or she will need to start medications for blood pressure. And for organs affected, blood pressure is going to affect the heart, the kidneys, and the brain. With the heart, it can cause several heart conditions. The kidneys, it can lead to kidney failure, in which people might now be dependent on dialysis. For the brain, it can lead to stroke. And stroke is getting to become one of the commonest medical emergencies in our environment now, and it leaves people with with a lot of disabilities. So if blood pressure is a no-no, everybody must check their numbers, and everybody must ensure that their numbers are within the normal checks.
Okay, thank you so much, sir. So the next question is, thank you so much, sir. The next question is, what symptoms should I be concerned about that will warrant me going to check my heart? And what are the different signs of heart issues in men and women?
Okay, so I'll just basically recap symptoms and signs of heart disease. So for the symptoms, one, people can start top of the list is chest pain. Whenever you feel chest pain, that can signal a heart condition. Two, but beyond chest pain, which is even the topic of this webinar, beyond chest pain, the other symptoms that people can feel is palpitations. Palpitation basically just means awareness of heartbeat when you are not exerting yourself. So when you are at rest and you are aware of your heartbeat, then that's palpitations. That can signify heart disease. Thirdly, once people can start having leg swelling, once you start noticing your legs are getting swollen, that could be a symptom of an heart disease. The fourth is when people start having breathlessness, start having difficulty in breathing. Sometimes it's a difficulty in breathing on lying down. So sometimes some people at night, they just notice that whenever they lie down flat on the bed, they start having difficulty in breathing. That can signify heart disease. Five is poor exercise tolerance, in which some people know that walking down the road from the house to the junction, they do that fairly good within 5 to 10 minutes. But nowadays, they do that for a longer time, 15, 20 minutes, or they even find it difficult to complete what they used to walk before. So we call that poor exercise tolerance. That can also signify an heart condition. And so the other things might not be people can be feel sometimes dizzy. People can have fainting attacks. That can also signify heart disease too.
Wow, thank you so much, sir, for that. It has actually, thank you so much, sir, for that. It's been very educative. So the next question, we have loads of questions, but I'll keep taking them till we probably cover almost all. Next question is, good day, doctor. I developed BP issues during my last pregnancy. So I had my baby at 35 weeks. My baby is 1 year now, but I was placed on Aldomet. Now I take my drug alternate days, so I check my BP daily. I don't want to be on a BP drug daily at this my age, that is 37. How do I come out from this?
Okay. Okay, so Dr. Janet, so to the question as regards blood pressure in pregnancy. So people need to know that pregnancy, sometimes during pregnancy, people can have pregnancy-induced hypertension, in which the blood pressure is only during the period of pregnancy. But after the pregnancy, for people with blood pressure who has blood pressure induced during the pregnancy, some people the blood pressure will persist. In some people, the blood pressure will resolve on its own. So nobody we can easily hazard against to which category anybody will fall into. So we follow up people after pregnancy to find out which group they will belong. So if this particular person belongs to the group where the blood pressure will resolve, that would be fantastic and that would be good. But if the blood pressure persists after pregnancy, then the person might need to be on medications. Now this person is 37 and she doesn't want to be on drugs every day. Well, my advice is that, it's better to be safe. If you need to take medications every day to be safe, to take care of your children, your family dependents, I think it's safer that way rather than run the risk of blood pressure being high and eventually getting the organs damaged. So while I understand that sometimes people have a strong aversion to taking drugs every day in our environment, but we also need to know that we need to do what is safe for us, not for our own sake, for the sake of our dependents. So at 37, like I said earlier, people start developing blood pressure even from 20 and above now in Lagos. So at 37, there shouldn't, if you need to be on medications, then it will be safe for you to take the medications.
All right. Thank you very much, sir. Thank you very much, sir, for that. So the next question, Hi, doctor. My mom is 54. I have watched her diet, so she doesn't have much so she doesn't have much salt intake. She doesn't go through much physical stress. She uses her drugs daily, but her blood pressure has been raised for a while now. What else can I do for her aside diet?
Okay, yeah. So we need to understand that we need to people need to get their medications adjusted from time to time. So for blood pressure, the medications are not fixed. So, and that's the purpose for follow-ups and checkups. So I'm sure when you go to see your cardiologist or you go to see your doctor, they give you an appointment. Some people 1 month, 2 months, 3 months, 4 months, 5 months, based on the assessment of the cardiologist. So what I would advise is that if the blood pressure is still not well controlled for your mom, you might need to get her to book an appointment to see a cardiologist and get the medications adjusted. They might need to add to the medications, and they might need to increase the dosages of some of the medications. So we need to know that medications dosages are not fixed. Sometimes I see some people say I've been on this drug for 5 years, for 10 years, and nobody has reviewed them. Well, that might not be safe. The safe thing to do is to ensure you go for regular checkups, and during those checkups, the dosages of medications are going to be reviewed for you.
Okay, thank you so much, sir, for that. So I'll take a few more questions before we close because there are a lot of questions. Well, this means this session is engaging, but I'll take a few more and we close. Someone wrote, I've been having irregular heartbeats, but my BP is very normal and I don't have difficulty in breathing, but the palpitations are worse when I am lying down. What does this mean and what do I do?
Okay, irregular heartbeat with normal blood pressure signifies a group of heart conditions we call arrhythmias. This particular person might be experiencing any of the type of cardiac arrhythmias. It's actually a serious heart condition. So I'm going to advise you need to book an appointment with a cardiologist. You need to get that evaluated. You need to do some investigations, 24 ambulatory ECG monitoring, in which we need to study the rhythm of the heart and know what is the cause of the regular heartbeat you are having. So it's not normal. It's one of the heart conditions, and you need to see a cardiologist as soon as possible. Also, I also advise that you need to avoid stimulants because stimulants are going to worsen those regular heartbeat for you. And for a lot of them also, sometimes exercise also worsens them. So you might want to avoid any form of exertion and avoid stimulants till you see your cardiologist.
Wow, very well said, sir. Very well said. So I would move to the next question. It says, I am 34 now. No. I'll go to the next. It says, hi, doc. I am 29 years old. Few days before, I'm 29 years old. Few days before I had my miscarriage, I had an episode where I felt pain in my chest, which lasted about 5 minutes. 3 days later, doctors confirmed that I lost the baby. Was the miscarriage in any way related to the chest pain, and what can be done to avoid reoccurrence? And someone wrote, can BP issues cause stillbirth? I want to know, doctor.
Well, to the first question as regards the chest pain and the miscarriage. Well, I really don't know what the cause of the chest pain is, so it will be difficult to put a direct relationship between the chest pain and the miscarriage the person has had. I know hypertension, blood pressure in pregnancy can lead to miscarriage. if the blood pressure is very high and there's antepartum hemorrhage. So I think the most important thing is that it depends on what the issue. But generally speaking, I don't think a chest pain will on the surface level will end up can predispose somebody to have a miscarriage. That's the first question. The second question again, Dr. Janet. Second part of the question.
It says, can BP issues cause stillbirth?
Okay, can BP issues cause stillbirth? So it depends. So if you have complications of hypertension in pregnancy, and it leads to preeclampsia, I don't know. Sometimes that can predispose to intrauterine fetal death. So it just depends. So it might not be a complete direct relationship, but complications of hypertension in pregnancy can result in this. So the general advice is for people to know that in pregnancy, they must also ensure that their BP blood pressure is well controlled, so that they don't develop complications of blood pressure in pregnancy. And we should also have it at the back of our mind that one of the commonest causes of even deaths during pregnancy are complications of hypertension. Even in the advanced countries, hypertension and complications of hypertension constitutes a significant proportion of maternal deaths even in such environments.
Okay, thank you so much, sir, for that. So we'll take one last question and we'll close out. So the last question is, I am 34 now and I have been taking blood pressure drugs for 2 years. I'm not married yet, but will this affect my sex life when I get married?
Okay, is it male or female? Okay, we can switch it on both for both male and for female. Blood pressure medications as so generally speaking for the it has no effect on fertility. So for the female, so if you are making for blood pressure, it's not going to reduce fertility. So you can get pregnant and you can have as many children as you want as you want. And it doesn't affect sex drive. So your sex drive is going to be fantastic for a female. For males, so some of the medications actually could actually reduce sexual function, but you might need to speak to your doctor. So some drugs are quite notorious for that. So you might want to avoid the ones that are notorious for that and get the ones that are very compatible and at least will give you a good sexual function. But like we generally say, it's better for you to be safe. It's sometimes some people they come to the clinic, they get medications, and they sense that their sexual function has declined, and because of that, they stop medications. This is not wise. It's not wise for people to stop medications on their own. If you come to clinic and you experience declining sexual function from medications, advice is just for you to come back to the clinic, complain that to the doctor, and I'm sure the doctor is going to advise you better. He can switch you from one class of medication to another, or he can further do some further evaluation to find out is it actually the drugs that are causing the declining sexual function, and if it is, that will be surely be addressed. So I think the take-home point here is that people should not stop medications on their own when they perceive there is declining sexual function. When they experience that they should come to the clinics, there are options available to actually help them to be on the medications and improve their sexual function.
Wow. Thank you so much, sir. Thank you so much, Dr. Akingunmi, for such an awesome presentation, and thank you for taking out time to answer all the questions asked. It's been very, very educative, and it's been very enlightening. So before we close out, can you please just summarize and tell us just general things we need to know? Just give us few parting words so that we take home today, and we know we've learned, especially for those that joined late, just few parting words and a general summary of the topic we have today.
Okay, so thank you very much, Dr. Janet. In closing, we have talked on the topic of beyond chest pain, overview of heart illnesses. So we've said that beyond chest pain, other symptoms and signs of heart disease includes palpitations, awareness of heartbeat, people having difficulty in breathing, people experiencing leg swelling, people experiencing poor exercise tolerance, in which the level of exertion you used to tolerate before, you can no longer tolerate them. We've also discussed risk factors for heart conditions. We've discussed risk factors that include smoking. I thought that people need to quit smoking. We've talked about alcohol. People need to reduce stop alcohol. We've talked about obesity. People need to undergo weight loss regimen. We've talked about family history. We've talked about the fact that family history is one of the most important risk factor for heart conditions. The way people inherit skin color, the same way people inherit color of the eyes, people inherit blood pressure and other heart conditions. So it will be safe for us to know from our family members if they have any heart conditions. We also talked about stress as a risk factor. Stress includes physical stress, emotional stress. We also talked about the fact that lack of sleep is also a stress. People need to sleep well. 6 to 8 hours in a day of sleep is very good. We also talked about diet as a risk factor, dietary indiscretion, excessive intake of salt. Salty foods in the environment includes suya. For people who take pepper soup outside, it's actually very salty. I've talked generally that people need to reduce salt by 50%. So whatever quantity you use to cook, you just cut down by 50%, including Maggi and curry and thyme. So if you use 4 cubes of Maggi, you need to reduce to 2. If you use 2 cubes, you need to reduce to 1. We've also talked about the use of stimulants as risk factors for heart conditions. Stimulants includes coffee, both the caffeinated and the decaffeinated. It's coffee. Use of cola nuts, and people use cola nuts to stay up to read at night. Also, intake of energy drinks for young people. A lot of young people indulge a lot in energy drinks. These are risk factors for blood pressure and other heart conditions. Alcohol also is also a stimulant, so people need to avoid stimulants as much as possible. I've also talked about the fact that there are treatment options, medications, surgery for people with valvular conditions, procedures for people with coronary artery disease. I've talked about for blood pressure medications, the best taken in the morning, and people should ensure that they take medications every day. I've also mentioned that when people have untoward effects from medications, including declining sexual function, people should not stop medications on their own. The safe thing is for people to ensure that they come back to clinic to complain about such untoward side effects, and such drugs will be changed for them to other better options, and also they will be properly advised on the next line of actions for them to do. Also, people should ensure that there are no fixed dosages for medications for these conditions. So people must ensure that they adhere strictly to follow-up visits. These follow-up visits are to ensure that those medications are being looked into. And also, people should key into doing annual screening. So we must ensure that you tell your doctor that, of course, you need to be doing some tests every year to assess your health. Once you see your cardiologist, tell your cardiologist, okay, so for this year, I need to do my screening, I need to check this, check that, check cholesterol, check this, and I'm sure all those tests will be written for you. Thank you very much.
Thank you so much, sir. Thank you, sir, for taking our time to talk to us. It's been I've learned a lot myself, and knowledge, there is no knowledge lost. And I'm sure everybody who joined us today learned one thing or the other, and a lot of us asked a lot of questions. So thank you, sir, once again, for taking our time. So if you have more questions, you can still post them. We are going to send them to Dr. Akingunmi. Hopefully we get responses, and we're going to send them back. So most of these questions are even anonymous, so it's hard to send them back the responses back because we couldn't take all the questions. Apologies for that. So thanks everyone for joining us. We have come to the end of the webinar. If you missed one or two things, or if you didn't join us from the start, the video is going to be on YouTube at Avon HMO. You can watch out the space sometime next week. The video will be posted, the full video will be posted for you to watch and learn more on some things. So thank you everyone once again for joining, and do enjoy the rest of your day. Bye everyone.